During the last hour, the city of Cleveland has the highest level of childhood lead poisoning in the United States. It is a problem that has plagued the city for decades. Senior health correspondent Monica Robbins continues her interview with the city's health director about what parents need to know to find resources and also help their kids.
So what's the answer to this? Is it going door to door? And who's more important, pediatricians or women who are pregnant? Because, getting a child tested and you find a higher lead level means they've already been poisoned.
That's right. That's right. So in order for us to improve the lead poisoning rate in Cleveland, which we are going to do, we need to fix homes before families are raised in those homes. And so working with pregnant women and our Moms First program, and we can talk to them about what kind of home do they need to live in so that their baby can be raised in a lead-safe or lead-free environment.
And what about for kids and pediatricians? What should pediatricians be doing?
Well, every 1-year-old visit, every 2-year-old visit, and potentially beyond, there should be a lead test. It should just be a routine part of the visit. And then those pediatricians, right now, and increasingly so, need to have conversations about not only, your health and your weight and what you're eating, but where do you live? What's the environment like? What can we do to change that? What can we do to help you find an apartment that is either new or it doesn't have chipping paint? Doesn't have the peeling paint on the outside, on the outside shingles, on the siding. Doesn't have an old porch that's full of paint that was painted there 100 years ago that is now starting to chip and end up in babies' mouths.
Do you think a lot of parents don't realize the massive amount of danger that a child is in relating to lead poisoning?
I think that the story of Flint, Michigan was so powerful that a lot of families in Cleveland are more worried about their water than the clear source of lead poisoning, which is the chipping and peeling paint on their windowsills. And so we'd like to change that, and that's why we're trying to get the word out so that folks know when they think about lead poisoning, that's the source. It's those old wooden windows, it's the porches, it's the doors. And so we got to make it easy to do the right thing, easy to do the healthy thing.
So for people who don't understand, what are the health dangers that a child faces with lead poisoning?
So lead in your blood, and it can come in through dust that a baby's putting their hand in their mouth as they're crawling around, causes irreversible brain damage. It causes slowed thinking. It causes learning disabilities, trouble in school, trouble reading by the time you get to the 3rd grade. All these things that are subtle that you might not notice unless you get that test at age 1 and 2, unless you clean up your house or get resources to fix your home or end up in a home that's newer, built after 1978, so that you don't have to suffer from these consequences.
So final thoughts, parents and pregnant women who live in these houses that might be concerning, what do you want them to do?
I want them to call the City of Cleveland to see if they're eligible for resources. I want them to call the Lead Safe Resource Center to see if they're eligible for resources to fix their home. And I want them to consider looking for apartments that don't have chipping paint if they're able to, that are built after 1978 if they're able to, because we're all in this together. We need to work harder to improve old homes, tear down old homes, and build as many new homes as possible.
Dr. David Margolius, thank you so much.